So actually, I'm happy to discuss about the abstract presented by Dr. Matteo Lambertini and his team at the profit paper session, looking at the safety data with regard to assisted reproductive technology among young breast cancer women who are actually BRCA carrier status patients. Actually, in this study, this is a retrospective cross-center study involving international network with international consortium involving 78 centers. So basically, they look at the safety data with regard to the use of assisted reproductive technology. Roughly 1 in 5 patients who are actually pregnant after breast cancer treatment, and the use of ART seems to have no negative effect on either the maternity outcome or the fetal outcome. There is no negative impact with regard to the breast cancer clinical outcome or survival status for these young women who have become pregnant after the treatment, and also there is no negative events with regard to the prognosis of the patients as well as the fetal or maternal outcome. Now, one of the caveats about this study is we still need some prospective data, but as we all know, because for BRCA status patients, it accounts for about like 1/10 of all the breast cancer women. So in terms of numbers, it's a bit relatively difficult to do actually prospective randomized controlled trials. So these collaborative network with regard to real world data is actually very important. We also look at the age at presentation and also the age actually having oocyte preservation at the time of diagnosis. So we see actually about 45% of patients, the majority, having the fertility preservation strategy at the time of diagnosis as compared to the use of controlled ovarian stimulation or the oocyte donation after the diagnosis and treatment of breast cancer.